really excited to partner this year with the Women Wellness and Health and Wellness Conference. And, for me, I joined Vivo just a year and a half ago. And my background is I'm actually a pharmacist. And, it's been such a fascinating journey, getting immersed in the cannabis space over the last year and a half. I spent a decade in the pharmaceutical industry. And, I think this conversation today is such an important one that we're going to be having. And I want to start actually by introducing the four lovely panelists that we have, which is a very diverse group of ladies. And I'm going to start with Ashleigh Brown. So Ashleigh Brown is the founder and CEO of She Can Cannabis, the country's largest and most engaged community resource for medical cannabis patients. As a patient herself, she works alongside stakeholders, industry members, and regulators to provide a patient-centric view of the medical cannabis system. She's been named Canada's top cannabis educator twice since the group's inception in 2017. She Can was recently voted Canada's favorite advocacy group, and it's an honor that Ashleigh says belongs to the 11,000 members and followers that make it such an important resource for patients. So thank you, Ashleigh, for joining us. We also have Jack Reed, and Jack is a strategist with a diverse history in marketing brands from supplements to topical remedies. And she spent the past 2 years immersing herself in the Canadian cannabis market. Her combined work experience and personal passion for health and wellness has culminated in her contribution to the launch of Lumina. She's a certified yoga instructor, and she spent time as an herbalist apprentice, and she's delivered all her kids at home via home birth. Now, we weren't able to have Bethany join us today, so we have Barb Vermeulen, who's joining us to represent Harvest Medicine. Barb began her career at Bedrocan in 2013, assisting thousands of medical patients make the transition from MMAR to MMPR while developing and overseeing the first patient care teams in the industry. Since her early days, her commitment to providing individuals with the highest standard of medical cannabis education in a stigma-free and easy to understand term has been instrumental. Upon completion of the Bedrocan and Canopy integration in 2016, Barb moved to Aurora, and she led a team of 50 cannabis educators developing effective patient and physician messaging and materials. And then in 2019, Barb joined the Aurora CSR team, supporting community-based initiatives with a special focus on mental health, poverty, and medical cannabis awareness. And last year, Barb joined Vivo Cannabis, and she's recently taken on the role of director for Harvest Medicine, which is our clinic network across Canada with telemedicine. And in this new role, she's focusing on scientific research, patient outreach, and a mandate for education, compassion, and accessibility for people who are seeking cannabis for medicine. And last but not least, we have Candice Hutchings. Candice is the face of the Edgy Veg, and she's on a journey to revolutionize how we think about food, eco-conscious living, and feminism. She's the author of a cookbook, The Edgy Veg, 138 carnivore approved vegan recipes, and Candice delivers vegan recipes with attitude and comedy. She's edgy by nature, and she's got a popular YouTube channel and Instagram page, and they've disrupted the vegan community with her candid and humorous take on activism, not only for animals and food, built differently, but also mental health, the environment, and female empowerment. Through her own use and experience, Candice is a longtime advocate of cannabis, and she's aiming to empower and educate women who use and are new to cannabis as a method for wellness, mental health, and self-care. She believes that the future is natural. So good morning, and thank you to our panelists for joining us this morning. It's been I'd say a really kind of crazy and tough year. The pandemic certainly has changed all of our worlds and flipped it upside down. And, I think it's taken a toll on all of us in some way, whether it's, stress and anxiety, unfortunately for some people, grief and loss and healing, stigma and prejudice. There's been a lot of big themes that have been happening in the news and in our society. And then also just the isolation over the last year. So I actually want to start by asking everyone, how are you doing? How has the last year gone for you? And how are you feeling now with, the acceleration of vaccinations? Hopefully this whole mental health crisis that's on our hands might start to come down a little bit, but I love to always just check in. I think that's the best way to start. So maybe we'll start with Barb. How are you doing these days?
If I were going to sum it up in one word, I would probably say tired. I think we're all tired, especially, with this being a women's focused event as well, especially tired. But also there's been a lot of gratitude. I think that this has certainly opened up my eyes into the importance of a few really key things, that being family, that being friendship, that being relationships where there is communication, and also to the importance of kindness and compassion. I'm the type of person who will always try and take something positive away from this. And while around me, you see so much sadness and so much isolation and so much loneliness and so much pain. It's very difficult. So it's, for me, become very imperative to try and shine a light and be that light, which can sometimes be tiring. So I'll leave it at that, but utterly, completely worthwhile.
I agree with you. I think we're all very tired. I saw everyone else nodding. Ashleigh, how about you? How are you doing these days?
Carole, yeah, I think tired is an appropriate word, and Barb is eloquent as always. This last year has been really interesting for me professionally because, when everything happened, I had this community of, 5,000 very engaged members kind of looking to each other and wondering what was next for them, as parents, as caregivers, as employees, as people living with disability and illness, what was this all going to look like? And I kind of quickly realized that the first thing that we needed to do is give each other space and a lot of patience and compassion, because, it's challenging enough to live with chronic illness or pain or disability in a functioning world. But now we have this world that's getting smaller, and that's familiar to a lot of people with disability. It's something we know about. We know about the isolation and the restrictions. But I really looked to my team and said, this is a time where I'm going to give you permission to do absolutely nothing at all. And, if you have to step back from volunteering, this is mine to carry. And that's what we're going to do together. So I have the capacity to hold this space, not only for those moments where, you're falling apart, but also those moments where you just, want to focus on something else. So we did diversify our content a little bit away from cannabis in the early days, really just to make sure that the space was a port in the storm. So when there was lots of, chaos on social media and people's wicks were short, so to speak, that we could hold a standard that this is a place you could come, and it was a culture of openness and compassion, which ultimately is what, cannabis has given so much of to so much of us. So I think for me that has been a big part of it. I have, adolescent daughters who are 12 and 16. So it's really the first time I've really had to focus on their mental health as almost nascent adults, right? So, it became about what's in your toolbox. And that became kind of the mantra for everybody, is that some days there is nothing left. And so when people would ask me how I was, as we do, right? We're in meetings, we're on calls, we're talking to people, not seeing them so much. I would just say, yep, because that was the most honest answer I had, is yes, I'm still here. Yes, we are doing our best. And so, I think it's been a year of making space for the fact that there are things we cannot fix. So much like, access to cannabis, much like, dealing with health and wellness, we also needed to make space for the fact that there are some times where there is nothing we can do at all except show up for each other.
Yeah. And taking it a day at a time, and being part of your group, it's very powerful. You can feel the strength and the love and the compassion coming through every single post and comment. So it's wonderful that you've got that space in that community. Jack, how are you doing these days?
That question is always, I don't know, right? I assume I'm okay. I'm on top of my mental health. I take care of myself. I'm really proactive in terms of self-care and health. And I suspect that the impacts of how we are doing collectively aren't going to be known for a while. That is kind of my instinct on this whole thing. Like right now, I'm holding it together. I've started 2 different jobs during the pandemic, which starting a new job remotely is intense. And I live at home with my youngest daughter, who in Quebec, we do CEGEP, and it was all online and she just wasn't connecting. And so we were just like, you know what? Don't bother. It's a waste of your time to just sit there and stare at classes that you're not resonating with. So we picked up a homeschool opportunity, right? So that's kind of how we adjust it, because we're both here all the time. And I had some skills to share that she wanted to learn. And so we figured it out. We built ourselves something to do. But to your point, Ashleigh, one of the things that was really important was to just not do something sometimes, like not worry about it, not do your seja. It's not the end of the world. You can do the next semester if that's the way you want to go. Like, this is a hopefully once in a lifetime moment. So let's take from it what we can and not pressure ourselves to keep going necessarily, or at least not keep going the way we have been. So that's it. I mean, I'm sort of preparing myself for the next phase. Like, it's very exciting when things open up, but I am mindful that this is when we might see the cracks appear a little bit. So to just be on top of that.
Yeah, definitely. We still need to be vigilant, and I completely hear your sentiment around, being flexible, right, and adaptable over the last year, just so we can move forward and look towards the future. And Candice, how about you? How are you doing these days, and how is your world during the last year?
Yeah, I mean, I can definitely echo what all of the ladies have said. It's it's had its moments where it's tougher, but I've also had some really special moments as well. I come from a family where we're not very close. I have two sisters and mother, and my parents are divorced, so we just don't really speak. It's been a really weird place for us for most of our life. And during the pandemic, we talk every day now. So that's a very special thing that came out of that. I think that all kind of stems from gratitude. While it's all very difficult, I think for some of us, for a lot of us, I think we did really have to kind of look internally and kind of force ourselves to, maybe at the beginning, to be grateful for the things that we have. And I think that kind of just snowballs. And then the learnings, I mean, all of the negativity aside, there's been some really important lessons. I think a lot of us have been forced to learn, or topics that have really been brought right into the forefront that we have to face. And I'm really grateful for those as well. So it's been a little bit of a mixed bag. And I think that's kind of the same for everyone, but overall, chucking along, doing well.
That's great. I'm so happy to hear that. There was an interesting report that Health Canada put out last year. So for 2020, they do an annual Canadian consumption survey, and it was the first time they asked a question specifically around COVID-19 and the impact on cannabis consumption. And so, from that, it showed about half of people consumption was the same. 22% were, increased, and 22% actually decreased. And so, I would love to, check in with this panelist. Do those numbers sort of resonate with your personal experience? Did you see an increase or decrease in your consumption? And do you think that any of those patterns are actually here to stay in the long term, secondary to all of the things that we're experiencing with COVID?
Well, I'll jump in. On a personal note, one thing that I find very interesting is that the older I get, the less I consume, the less cannabis I consume as a rec user. I'm now almost purely a medicinal cannabis user, which I use to address a couple of conditions. PTSD is one of them. I also have pretty severe muscle spasms from time to time. And so for me now, cannabis has very much become purely medicine, where again, I came to it, and I'm sure we'll get into this in the conversation. I came to cannabis as a self-medicating individual and didn't realize that, hey, I'm actually treating underlying health conditions here with my cannabis use. So it's been really interesting in that regard for me during the pandemic, seeing it taper off, and I'm very specific. Certainly though, I mean, on the clinic level, on the patient level, we see a lot of people who are seeking access for anxiety. I think that's been a big factor in as part of COVID. So certainly, I think that you'll probably see more cannabis use post-COVID. I'm willing to bet on.
Mm-hmm. Yeah, I would have to echo what Barbara said as well. I felt that my recreational use definitely went down. I think for, I guess, all substances, alcohol, everything else included, and that my use for medical or wellness, and I don't mean just anxiety, depression, but just wellness in general, just feeling better, making my body feel better. So topically, for example, we're doing a lot of sitting, our backs, God, what is the long-term effects on our backs? And just sitting, maybe not the most ergonomically. And so topicals for me it's definitely shut up in terms of use.
I've been exploring it with my job's pretty cerebral, so I'm in my head all day. And when I don't have a commute and I don't leave the house and there's a curfew because I'm in Quebec, right? You're in the walls. I use it to stop my brain, like it's really to put myself back in my body. Otherwise you stay up here, right? And then the disconnect happens. And I found it really, I think I probably always used it for that, but I didn't recognize it so clearly. And it really defined my relationship with cannabis and the benefits, and I've been experimenting with different formats, different types to find, and it's so much fun to be able to know now and understand, oh, this is what I want to feel. I can do this, and it's been a really great learning period for me and cannabis.
And Ashleigh?
There's two things that we noticed early on. We polled the SheCan community probably about a couple months into COVID and asked, are you consuming more cannabis? There's a variety of reasons that members of SheCan consume cannabis. And yes, absolutely, overwhelmingly, 72% of SheCan members were consuming more cannabis. And I think that was due to, a few factors, including the fact that when you are living with stress and chronic pain, they feed each other. So I think there was a lot of medication, kind of increase in medication. But the one thing I will say that I think is really important is that as women, we often seek permission to take care of ourselves. So with cannabis, here we are in this new environment, Jack's talking about homeschooling. We've got no more commute to work. There's all these differences in our landscape, in our routine. But sometimes we leave that part to last. And, how many times have you been, on a call or in a meeting and the woman is the last to run to the bathroom, right? So we almost need permission to take care of ourselves in that way that makes sense. And for a lot of people, that meant consuming more cannabis. And we talked a lot about that as a community because it can feel like, well, is this too much? Or, do I really need this? And the answer is that only you know that. And allowing yourself to explore that in different ways because, you're at home now, so you're going to try a different format or maybe you need to dose more frequently. Having the space to do that and giving yourself the permission to do that is so important. And I think that is one of the reasons that we've seen cannabis consumption go up is that you are now, more alone. And you are very much in your body and you are at the whim of the other, beings in your house. So what is it going to look like to put yourself first, to not delay that dose of medicine because your back is hurting, to take a little bit of time to, have an edible or apply a topical and to do that as needed instead of, as directed. So I think that has been a large part of things in terms of cannabis consumption, the ways in which people consume too. I mean, if you're home and now you're not, doing your normal thing, maybe you're not able to get out for a walk because you've got small humans, you're looking for discrete options. I have so many community members who said, we've got an elderly family member living with us. They don't like that I smoke. I'm looking for an alternative, or I can't go where I used to go to get what I need. Would a topical help? So I think that there's a lot of kind of understanding the nuances and also understanding your own need and really honoring that and being okay with it.
Yeah. It's interesting listening to you, mention as directed versus as needed. As a pharmacist, that makes me think of a prescription versus something that's more over the counter, right? That you could just walk in and sort of take sort of at your leisure, depending on the condition. And, it makes me wonder, have you guys noticed any difference in sort of where you're accessing your cannabis, as a result? Because what we've seen from the Health Canada data, right, is that the registrations have come down significantly. There was an extension on the authorizations because overall the entire referral process of getting to see, your general practitioner who would then refer right over into the clinic, which is what represents the majority of medical registrations in Canada. That model definitely, it's changed a little bit because of the pandemic. So, I cannot believe that those patients maybe have just disappeared. So, Barb, I'd love your thoughts. I know that you're, on the front lines at Harvest Medicine.
Absolutely. And I think it's really interesting because I think that the shift, because we're essentially completely virtual now. So it's virtual visits only, telemedicine visits only. And what's really fascinating is that I would say that from the patient feedback that we get, some of them are ecstatic and over the moon and will say, I will never come into the clinic again, because that suits their needs. Some patients are very hands off. Some patients, it is extremely stressful for them just to have to take the steps to come into the clinic. And so for patients to have that option, and also to a privacy thing, because we're still dealing with stigma. A lot of people don't feel comfortable marching down to their local cannabis clinic. Heaven forbid someone see them in the waiting room. That still exists. And that's something that we need to address. And so virtual visits really give them the opportunity to really discuss things, in a space where they feel comfortable. And I think that's a big win. On the other hand, though, we also have patients who live in isolation. And where sometimes their visit or their phone call to our team is literally the only person that they may interact with. And that interaction is really, really valuable. And really important to our team, and we're very aware of that. And so for patients to have that space, I think is really important. I don't want to talk too long on this because this is an issue, and I know Ashleigh's going to nod her head. Like, we could have an entire conference around this, but also too, the financial aspect and the accessibility aspect is that we live now in a world. I have two cannabis stores. I have two cannabis stores that are actually closer to me than my local pharmacies in my neighborhood. So essentially I can walk down to my rec store and pick up 5 grams or less. And that's another thing, cost being a factor. Being able to walk to a cannabis store and be able to buy cannabis in smaller increments increases affordability, because, oftentimes when you're chronically ill, you're not well. Money is tight. And sometimes you may just have $15 extra or $10 extra to spend on your medication. And therefore a recreational outlet might be more cost effective and easier for access. So things to think about.
Ashleigh, have you, I know that, we've had conversations about this previously, but just sort of like the two streams that we currently have, right? With medical, having to go through a clinic or getting the authorization from your physician and then getting it, sent directly from the licensed producer, the model that we're used to since legalization, just two years ago, right? 2.5 years ago now, with all the recreational stores opening up. Would love to hear what you've seen from the Chicane community in terms of what impact that's had on sort of this cross-channel movement, and whether are they staying loyal to the medical side because of the it's their medicine and it's stable and consistency of supply, and they're loyal to their LP, or are people just going also for the convenience and the access of the rec store, but the challenge there being that there isn't any medical guidance provided from a bud tender, for example?
So I'm a big fan of and both. I want people to have not either or, but and both. So whatever's going to work best for you is what I want to support and empower you with. And I will also say that one of the biggest myths about medical cannabis right now is that it's hard to access. So in Canada right now, you can go online and book an appointment without a referral, without a fee, without ever entering a physician's office, to discuss medical cannabis with a trained healthcare practitioner who specializes in cannabinoids. So you can do that through Harvest Medicine. They have an app, right? So that's how far we've come. A lot of people don't know that. So the perception of there being a barrier to medical access is a big part of what we have to talk about, is that now, if more than ever, you actually do have a right to that access because you want that guidance, and you don't have to jump through the same hoops that maybe we did 5-10 years ago. And I think it's really important just to highlight that, because the other thing that I hear so much of is we do see a lot of people come to Chicane and they bought CBD, at a dispensary. And of course, the bud tender at the dispensary, not for lack of wanting to, is not able to say, here's how you titrate, here are some drug interactions, here are some considerations for your condition. Like, they can't talk about it. Whether they want to or not is irrelevant. It's just, there is no face-to-face guidance that way. So often we have women who come to us and they say, I tried CBD, I took a milliliter, it didn't help my pain, like just wondering, like, I'd like to sleep, or, do you have any tips? And I think what I notice a lot of is we have this need to kind of minimize our own experience, right? So I'm not worthy of medical cannabis access because it's just sleep problems, or I just have a bum wrist, or I hear, because I have epilepsy, people say, well, I don't think I need a prescription because I have this, I don't have anything like you do. I have, I just have, sometimes I have pain, or sometimes I have trouble sleeping, or sometimes I have anxiety. And sometimes that's true. And I want them to investigate and be empowered to go on their way. A lot of times it's about saying your suffering is not in comparison to anyone else's. So as a woman, if you are having trouble sleeping, if you have anxiety, if this is disruptive to your well-being, I want you to have every support necessary and remove as many barriers as possible, because we won't be able to remove them all. And a lot of times that is getting a medical document, not necessarily because they feel like they're going to be using this, alongside pharmaceuticals and it's for the rest of their lives, but because in that moment, that is the best support that we can offer, because we are hamstrung. We don't have what is emerging as the most important kind of channel, which is a wellness channel. We don't have that yet. We have rec and we have medical. And ultimately, you can have hand in both. I purchase from the rec market because sometimes there's products I need. It's not a perfect system. We know that. We have a lot of work to do. I'm very stubborn. I'm not going to stop working on it. I'm not giving up on the medical system. But what I want is for women to know they have and in both, and that they don't need to gauge their suffering against what they believe is valid. So that's kind of another, version of permission, right? Is you have the right to that education, you have that right to that experience, you have the right to define what's going to work for you. And sometimes that starts with medical access, and sometimes it starts with investigation and charting your own path. So
I think with women, that kind of just stems over from the traditional medical practice and how we just aren't listened to, we aren't believed, we aren't empowered. The research just isn't out there for us. And I think that, now that women are becoming more of the conversation with cannabis when it comes to wellness and comes to health, we really need to be empowering women that this is a safe space. You will be listened to, that you're allowed to admit that you feel bad. I feel like, Ashleigh, you were saying before, like we tend to downplay our symptoms, no matter what it is. We tend to downplay, and we have a really hard time advocating for ourselves. And with this space, what makes me the most excited for it is not only that more women are taking top leadership roles and are creating these systems and support for other women, but it's that, it's that woman to woman caring and empowering for myself to tell my girlfriend, like, there is a stigma around cannabis, and there doesn't have to be. And, just because you don't want to get high doesn't mean that this isn't an avenue for you. There's so many ways that you can use this. And I think having that conversation is very important.
I would follow that up with creating really good content around that too, right? Like accessible, findable content for people who don't feel comfortable asking questions or needing the support. Like, I'm not saying replace, again, it's not a substitute for, but just to start the groundwork, to feel informed before you even go and ask those first questions, right? Like, so really flooding, I guess the internet is the best place to put it, with informative content. Like, I know that there's a lot of legislative limitations on that to a degree, but like really talking about the benefits and the uses and properties of all the different types of products.
And never, discount the power of your own personal experience.
Yes.
What I do on my social media, something that I really took was, it was about almost 3 years ago when I left my abusive marriage. And I started talking about my story because these stories weren't really, they were kind of out there, but they were really from a, not a victim shaming or blaming, but like, oh, this poor woman. It was never from an empowering standpoint. And I wanted to hear those stories. So I started talking about my experiences and how I went through that. And then other women started to share their experiences, and they were more comfortable sharing with their friends or sharing online. And I think, the power of your own personal experience, especially as women, I think we also tend to downplay that a lot, when those are the stories and experiences that we need to listen to, that we're craving so much right now for content. And I mean, so many more women have been coming out, especially on social media, and sharing their collective stories. And it's really inspiring, quite frankly, to, hear your experience from someone else's mouth. So, even with cannabis, where it's like, oh, I went through that too, and I thought that this was just a me problem. I think that those are so powerful.
Yeah, I think that the anecdotal, the connection to something, and then also the inspiration of how can I do that, right? How can I empower myself, and where can I find the tools to do that?
Yeah, and I think with stigma in general, the only way really we can overcome it is by continuing to talk about it, continuing to educate, and finding as many different forums like this to have these conversations. And I think with cannabis specifically, the stigma is really interesting, because it doesn't seem to be black or white. There's lots of shades of gray in there, especially, if you think about the product formats, right? Or even your motivation, thinking about rec versus medical, or even now wellness. And so, talk to me a little bit about stigma and how you see that coming into play as it relates to the different cannabis formats.
Well, isn't it so funny that women are less likely to openly smoke than they are to even, joint to vape pen? The difference there. Or like, I will openly use topicals around my family, but heaven forbid I stand out back and smoke a joint to help me with pain. And I think that that's just, it's such deep-seated internalized misogyny and sexism that we've just been carrying through our entire lives, that, something as simple as smoking a joint can be seen negatively for us, or unladylike for us, as opposed to, our male counterparts.
And even like that, the impact that stigma has held for so long. I know an older woman with Parkinson's, and we all know the benefits of CBD in helping that, right? And, I was speaking to her about talking to a practitioner, but there was just no way she was ever gonna, you know what I mean? Overcoming that stigma for her was just impossible, right? She'd just rather be in pain. And it's always shocking. Hey. Yeah.
It is amazing the lengths that individuals will go through, and the suffering that they will endure simply because of a fear of their neighbors, their friends, their families, knowing that they are using this horrible cannabis. And again, I think a lot of that is where education comes in. The more that we can talk about, and from a very scientific research base place of being like, hey, this is legitimate medicine. People don't understand that, medications are plant-based. This is a plant, but also too, having role models within the community. I mean, people are always really shocked when I'm like, yeah, you know what? I've smoked a lot of joints in my time, a lot of them. And people are like, but you're so articulate. And I'm like, yeah, because you can be articulate and still use cannabis. And so again, these very typical associations of the stoner, and we fall into these traps still. I mean, that vaporizing and vape pens are dainty. They're very feminine, and it's true. I mean, and there is this sort of internal struggle, because certainly there have been times where I've looked at a certain product and I'm like, oh, that's a nice looking product, but again, that's my aesthetic, and there is no shame in that as well too, that you should be able to enjoy the branding or a certain type of product if it speaks to you. So it's really deeply ingrained. It's a really fascinating conversation.
It's funny. I'm such a staunch feminist, but my favorite color is pink. So I hate the pink washing, but I also love it because I love pink, and I find my own judgment that way. Sometimes I'm like, I shouldn't like this because it's pink and it's sexist, and it's just how we constantly are fighting with ourselves and battling with our internalized images of ourselves and how we should be versus how we are. And it's just, I'm with you on packaging. I'm I'm a packaging slut. I love it, like sleek packaging. But then at the same time, I'm like, no, don't like the pink one.
Ashleigh, have you seen a change over the last couple of years with sort of product consumption format, from what you're seeing in your She-Can community?
I am so spoiled. I'm so privileged because I have the honor of holding space for thousands of people's stories. And when it comes to stigma, what I've noticed fundamentally, and you've all echoed this already, is practice makes perfect. So releasing that stigma and coming forward, coming out of the cannabis closet, however you want to call it, that has to be on your own terms. And sometimes women feel guilty because they're not comfortable talking about it with their family or with their friends. And the only place they talk about it is in She-Can. And they always say, oh, I'm just not, well, that's okay. We're going to meet you where you're at. So for me, the first year that I consumed cannabis, I talked about just using oil, right? So even though I was consuming via vaporizer, it just seems safer to tell people that I consumed oil because then they don't think I'm smoking around my kids, right? So that was kind of self-stigma as well, right? That's a different type of stigma. That stigma we put on ourselves, that's a standard we apply to ourselves, and it comes from a lot of different places, and it's hard to get through. But, here I was with the community at the time of like 2,000 people, and publicly, in my city, in my neighborhood, people didn't know I was a medical cannabis patient. And I had to do that on my own terms. So formats have been a really great tool for that, because sometimes we need to give ourselves a reason, and sometimes we need to take baby steps. So for some women, they'll take CBD oil because that feels comfortable to them, but they don't want to get high. And maybe they want to try THC, but they don't know how that's going to reflect on them. And what are their coworkers going to think? Or what would their boss think? Or, what if they saw somebody when they were out and had to explain it? I think that there's opportunities where they say, what about topicals? Well, topicals aren't stigmatized. There's nobody thinking that you're over consuming because you reapplied that to your sore knee. But if you were smoking a joint for that same pain, you may feel that stigma, whether it's real or imagined. And legalization, I think, really helped the stigma conversation. Definitely saw that in She-Can, saw that with lots of people, that, being able to know that something was legal and accessible for women made that conversation different, because there are risks. There's so many different types of stigma, and certain communities, whether they be whether they be marginalized communities, they face different levels of scrutiny around their choices as parents, as partners, as, employees, as humans. So I think understanding the nuances of stigma, understanding that sometimes, that CBD oil is a gateway into finding what really works for you, and what really works for you may be, a couple hits off a bong. And so the pinkwashing of items, the pinkwashing of cannabis has been that we've limited women and said, well, women only want, massage oil. Women only want oils. Women only want discreet. The thing is, women want what we want, and what we want may look different today than it did yesterday and the day after. So as we're given access to more formats, we're really crafting that narrative. And I think that, that's where companies who are listening are really understanding that they can't put constraints on what it is we need, not for medication, not for wellness. And we have to realize that those are personal choices we get to make, and we get to vote with our wallet.
And to just kind of like piggyback off of that, I love the way that you say, even when we were talking yesterday, like women just want what we want, and we just want things to work. We want someone to listen to us and to prescribe or give us the advice of something that's going to work. That's what we want. And then, going back to the stigma conversation as well, not all stigma is equal, like you were saying. I mean, there is I live in Regent Park area, and there's a huge difference between me walking down the street and smoking a joint versus someone more north of me in Regent Park walking down the street and smoking a joint. And I think that's a very real conversation that we need to have and really, really fight, especially as people that do come from privilege and do, benefit from the color of our skin, for example, to really fight for not only our own stigma, but also the stigma of our sisters of all colors.
Funny, whenever I was walking down the street and I smell someone smoking a joint, I'm always looking for my friend. That's always my reaction to smelling weed out in the street.
So Jack, I have a question for you. I mean, I know you're a mom, so we're talking about stigma here, but I think being a woman is one thing, having the stigma is there, but I think also, being a mother, and I think Ashleigh touched on it as well earlier. Talk to me a little bit about the stigma of being a mother, working in cannabis, consuming cannabis, and how does that translate into how we as an organization, as LP, can do a better job of listening and actually trying to bring to market products that will speak to all of these women and this entire community that we're talking about right now, which is, women, moms, everyone that really is looking to consume for wellness purposes.
Well, I think my personal experience was my ex-husband, their dad, he was a quintessential stoner. So there was already a stigma with us as a family because he was always in a cloud of smoke and didn't care. And our kids grew up quite comfortable around cannabis. It wasn't that. So I took the onus to be much more discreet and much more private about it because I felt like that needed some balance. Once we went our separate ways, I've always been pretty open with my kids about cannabis consumption. I've always been a pretty moderate consumer, and all of my kids went through their own time when they learned it and they did it, and none of them really took to it, to be honest. And I think the idea of changing the formats for how it can become more family centric, like it's the smoking, right? It's not necessarily the cannabis in a lot of cases that is the issue. It is the smoking. So I think that the more, and that's kind of reasonable, right? Like you can kind of see that smoking around children, it obviously makes sense. Not that smoking a joint is bad, but you can see where that's for. And so I really do think that introducing new formats that allow people to consume cannabis differently and treat it differently, like they're now using it in ways that are for health and wellness. And it's, even though we do smoke a joint for health and wellness, you get called out on that, right? Oh, you're smoking, right? So to put it in a category that lacks any hypocrisy, for lack of a better word, and really just can be consumed at home, it can be added to recipes, it can be eaten, it can be sipped on. I think that will very much help people see it as a health and wellness thing, right? Just like any supplement you would buy at the health food store or anything, or a herbal tea that you might take for something else. Like it will be introduced into that more readily as more formats come about. Plus, I think people are going to have fun learning and playing with these new formats, right? Like,
that's great, Jack. And actually, at this point, I'd love to queue up. We just have a short video that we wanted to show, and then we're going to pivot to Q&A and also just shift the conversation to sort of where wellness category, where it's going in the future. So if I could ask the WWC team, thank you. Thank you. So Jack, I know you worked on that. Maybe you can give us a little bit and tell us sort of, a little bit about Lumina, but where it fits sort of in this wellness landscape and where we see the industry going to help serve, this really important group of women that we're talking about right now.
Yeah, so when we were doing our research, I mean, there's two big things in sort of non-smoke, like in ingestible cannabis, right? There's the support category, which is very much, anxiety, calm, health and wellness, that space. But that can also be elevated to enhance, right? Like if you want to start enhancing your performance. So there's some people who take CBD to go to sleep, and other people who take it for a higher performing day, right? So I think this is a really fun space for Lumina to play in terms of like how people use this. And the oils are very adaptable. right? You can take them direct, you can put them in recipes. This is the nice thing for people to learn how to use these. And you can control your amounts, right? You don't have to eat a whole chocolate. You can take one drop. So I think the flexibility of how you can use these products. I know that the product lineup is pretty tight to start. You know, it's pretty consistent to start, but it's very exciting to see how people are going to use these and where they're going to want to go with them, for sure.
Barb, Ashleigh, Candice, you know, just as I know that there's some Q&A, so I want to just get your thoughts on sort of where do you see cannabis and wellness going? What types of products would you like to see to come to market that maybe aren't here yet? And, you know, speaking from a licensed producer, it's not so easy to turn it around immediately. We work really hard, but we're always listening. So I'd love to, you know, use this opportunity to really put it out there again. You know, what are we missing right now in the industry that, you know, we can work on doing better?
I would love to see more sexual health products for women. Someone brought that up in the chat, and that's something that I wanted to speak about as well. And I think that, you know, then we're taking two things that are stigmatized and just putting them together. And I think a lot of women, we just have been not necessarily repressed, but we don't necessarily have that empowerment to like take our own sexual health, you know, into our own hands, whether that is personally or with a partner. And I would love to see kind of that conversation and those products specifically formulated for those uses, whether that's, you know, to enhance, you know, activity, or even just, I know that a lot of women struggle with libido in general. So seeing if there's something that can be done that way. Yeah, I'd love to see that.
So anybody who's ever talked to me knows exactly what I'm going to say. So Carole's got the drum roll coming. Suppositories. I'll say it 3 times so I can make it happen. And I promise you all that I'm very fortunate to know that even though it may look like there aren't a lot of these formats in the pipeline, they're there and they're coming. And I'm really excited about the next year in cannabis, because it takes a lot to get a product to market in the legal market in Canada. It takes an immense amount of work. There are so many hurdles, but at the end of the day, that's how you know that the products showing up are the products that you want to consume. And I think we have so many opportunities, but also suppositories. And here's why, because guess what? Women want ways to consume that allow them to go about their day, but they also have all of these health conditions, including endometriosis, including, you know, severe cramping, pelvic pain, lower back pain that are not being addressed. And so this is something that I've been hearing from for years. And right now we don't have that opportunity. So I think it's important for everybody to know, as Canadian consumers, these things are coming, you know. I want to see more formats that, as you said, Jack, allow people to explore this in a way that feels right for them. So what does that look like? It looks like everything under the sun. It looks like sublinguals. It looks like topicals. It looks like enhanced products with ingredients that we want and that we understand as we become educated. And it means more options that allow us to explore both pleasure while treating pain.
Targeting.
Yeah, I agree with Ashleigh. I also have PCOS, and so on Monday, my ovaries were popping pretty painfully, and I was like, "Oh good Lord, let me just have a suppository. That'd be so great." You know, and it's true. This is a format, and more formats, and more topicals, and dermal patches, and all the things. Because again, relief comes in many forms. We are all not the same. What works for one person may not work for another, and that is especially so in the cannabis space. I mean, one of the things that I've seen time and time again is you put 2 people in front of me, 3 people, 4 people. They all have the exact same symptoms. They all present the same. You give them all the same dosage, all the same product. One person will do extremely well, another person may not. You know, where you find your relief, you need options, full stop. I think what I'd also like to see is more conversations like this with women. Conversations with women who are 20 to 55, 65, of all ages, but especially women, I think, who are on this panel, women who are mothers, women who are caregivers, women who are caretakers, because again, it's one of the songs that we were playing before we came into the seminar was "We Run the World," and we do. Our strength makes a difference in this world, and we need to be healthy and well so that we can affect this change. And I think that cannabis plays a huge part of that. And so to address that and bring us into that conversation and create products that help us are essential.
I think what a lot of women don't realize is that they really can throw their weight around. Like, we make the buying decisions. Like, so many decisions are made by women in the home. And I think that what I keep getting reminded, especially during this panel, is like, we have so much say and so much power. We just have to throw our weight around a little bit and, make a lot of noise, right? The squeaky wheel gets grease, right?
Vote with your wallet. Vote with your wallet. That is the fundamental thing you have as a woman in cannabis and as a consumer. You make the decisions for your household. You make the decisions for yourself. Put your money where you feel people are investing in you. It works.
Yep. And just say something, be present, be there. The older I get, the more confident I get. And I speak very, very freely these days because your opinions are valid. That's it.
So we have 5 minutes left, and I want to just take a look at the chat because we've got some questions here from the group. So there's a question here: what can we do as women retailers to be able to effectively engage in the political change of being able to market and promote health and wellness more broadly? That's a question from Leanna. So anyone have any comments or suggestions for a retailer who's interested in promoting health and wellness?
So I've been thinking a lot about this because I think a lot of people assume, because my focus is medical, because my personal story is very medical, that that somehow creates a divide between rec and medical. And what I've noticed is that some of the people that I want to hear from the most are actually the female bud tenders. So I encourage them to join She Can, because you learn and interact with people you're seeing every day anyways. And while they may go on to become medical patients or not, the more informed and supportive you feel you can be, the better off you are in terms of advocating and becoming that voice. Because that's where advocacy really lives for women, is in those one-to-one conversations. That's when we see the patterns. That's when we see what needs to change. That's when we see the opportunities to kind of raise that collective voice and say, okay, when is this cannabis health product category coming? Okay, what do we need to get products into the queue? Okay, what companies are listening to us? And then the retailers are making the decisions that support their goals, their health and wellness goals, and their customers. Because if someone comes in and you maybe don't have all the answers, but you have a place to send them, or someone comes in and you can say, we know these products are coming, that empowers them and probably leaves you with a repeat customer.
And on top of that too, I think dialogue and content, wherever you can have that conversation, if it's on social media, if you have a blog, if it's on your own website, right? You put your credibility on the table, but you're also listening, as long as it's coming back to you, right? So that your consumers are hearing what your answers are, and it's reflected obviously in your product lineup ultimately at the end of the day.
Let me just see if we have another question here. There is a question here saying, do you see hemp being separated from the Cannabis Act like the US for wellness products? It's a question from Kathy. So I think this speaks maybe a little bit, Ashleigh, to the cannabis health products that you were mentioning. I don't know if you want to take a stab at elaborating.
I think it's a little bit above my pay grade because Health Canada doesn't currently allow me to make decisions, but hey, maybe that'll change one day. It won't. I think that what we're seeing with cannabis health products is that the government is saying, sure, absolutely, very interested, bring us the research. And so it's less so about hemp versus cannabis in Canada and more about, medical versus rec, proven claims. So regardless of the source of CBD, regardless of the source of the product, can you prove that this is going to do the thing you said it's going to do? Is it going to help with eczema? Is it going to help with sleep? And that is really the cannabis health product category. That's going to be the distinction. And I think there are companies that will step up to the challenge and do it. And they will be the companies that win in both spaces.
That's great.
Again, just going back to that data and that research, which is so important. I know that we hear a lot from patients of like, oh, well, questionnaires, why do I have to fill these out? And oh, why do I need to know? And it is simply because in having that information, because we keep hearing, I've been in this space for a long time, and I still keep hearing, we need the clinical evidence, we need the data, we need the scientific studies. And to be quite frank, sometimes I feel like, holy cow, like, am I still in like 2016 here? Like, why, where are these studies? And they are coming, but they take a long time. And what we need is that body of evidence. We need that research so that we can then go to Health Canada. So we can go to places and be like, listen, this is the correlation. This is real. This is the thing. So let's go, so perhaps I'm a little impatient. And, Ashleigh and I were talking about this, of just the sheer infancy of this industry. Like, I even sometimes forget that, like, if this were the car industry, let's say if this were the automotive industry, we'd still be in Model T times here. And I think that, thank goodness, we live in accelerated times right now where things move and progress really, really quickly, a lot more than they used to. But in the meantime, it's an urgent issue because people are hurting, people are in pain, people need help, people need solutions. So if we can drive things forward as best as possible, then by all means, we all need to push together.
That's great. We are unfortunately at time, ladies, and I just want to say thank you to all of our wonderful panelists. That was a fantastic conversation. I think great way to start day one of the conference, and want to thank also the Marigold PR team for their support. And listen, this conversation around health and wellness, this is the conversation we have every day at Vivo Cannabis. We are working really hard to bring some novel products to market. We're looking at bringing the data and the claims through Harvest Medicine. So we're, hoping that, we'll have more great news to share in the next little while. And we really appreciate everyone's attending this conversation. And please stay in touch. Follow us on LinkedIn and please reach out and stay connected. Thank you so much.